Today, we'll break down which drinks you can actually have with diabetes without harming your blood sugar, and which ones just give the illusion of being healthy. There are tons of tips online. Some people claim that cinnamon lowers blood sugar, others suggest drinking turmeric, while others recommend ginger, apple cider vinegar, or some miracle blend of 50 different herbs. But if you look at the recommendations from endocrinologists, the picture turns out to be completely different. So today, I'll show you which drinks are actually suitable for people with diabetes, which ones are better left on the store shelf, and why even the label sugar-free doesn't always mean the drink is safe. And let's start with the most common mistake. Not everything labeled sugar-free is safe for people with diabetes. Very often, someone goes to the store, picks up a bottle, sees the big attractive label no added sugar, and confidently puts it in their cart. It seems like everything is fine, but if you turn the package over and look at the ingredients, you might find fructose, molasses, corn syrup, maltose, or a dozen other fancy names. And here a logical question comes up. If there's no sugar, why aren't these ingredients allowed? The answer is very simple, because our bodies don't read labels. It really doesn't matter where the glucose comes from. White sugar, cane sugar, honey, agave syrup, or fructose. If carbohydrates enter the bloodstream, blood sugar starts to rise. That's why the first rule is very simple. Don't look at the flashy labels on the front, but at the ingredients list on the back. That's where the real truth is hidden. Which sugar substitutes really don't raise blood sugar? There's sugar substitutes that have almost no effect on glucose levels. For example, stevia, erythritol, or ready-made blends based on them. Yes, they're sweet, but the body processes them very differently from regular sugar. That's why, after a cup of coffee with stevia, your blood sugar doesn't spike the way it does after a few spoonfuls of regular sugar. That's exactly why these sugar substitutes are allowed for people with diabetes. But what about all the scary stories about erythritol? As soon as you start talking about sugar substitutes, there's always someone who says, I read that erythritol causes cancer. Let's calmly sort this out. Yes, there really was a study that caused a real panic on the internet. But the problem is that most people only read the sensational headline. First of all, it was about very large doses. Secondly, not all results obtained in the lab are automatically confirmed in humans. So, as of today, there is no convincing evidence that normal consumption of erythritol causes cancer in humans. Is it true that sugar substitutes cause an insulin spike? This is another myth I regularly come across on the internet. It goes something like this. You taste something sweet, your body thinks sugar is coming, releases insulin, your blood sugar drops sharply, and you almost pass out. It sounds nice, but it has almost nothing to do with actual physiology. Insulin is released not because your tongue sent something sweet, but because glucose actually entered your bloodstream. If there's no glucose, the body simply has nothing to react to. That's exactly why, in all my practice, I've never seen anyone end up with hypoglycemia just because they drank tea with stevia. If this really worked that way, endocrinology departments would be overflowing, but for some reason that's not happening. Now let's talk about a drink that people with diabetes really should avoid. These are packaged juices. Very often people say, "Doctor, it's juice. It's made from fruit, so it must be healthy." Unfortunately, it's not that simple. Many packaged juices contain so much sugar that some of them can easily compete with regular sugary sodas, so you definitely shouldn't count on them being healthy. But even if the juice is freshly squeezed, that doesn't make it safe. And now I'll explain why. When you eat an apple, you get fructose along with fiber, and you have to chew. Your body takes time to digest it, and the sugar enters your bloodstream gradually. Now, imagine 4 apples. That's how many you sometimes need to make one large glass of juice. You can drink it in literally a minute, but not everyone could eat 4 apples at once. That's why juice always loses out to whole fruit. If you're craving something sweet, it's better to eat the apple itself, an orange, or a handful of berries. Your body will thank you for it. Since we're talking about fruit, let's answer another popular question right away. Which fruits can you eat if you have diabetes? In reality, there are almost no fruits that are completely forbidden. The amount's more important. Usually, a safe portion is considered to be about the size of your 2 fists per day. Your fist specifically, not mine, not your neighbors, not the bodybuilders from the gym, because everyone has different hand sizes. If you want to choose the safest options in terms of sugar content, I'd pay attention to berries. strawberries, raspberries, currants, cranberries, kiwi, grapefruit, and surprisingly, avocado are also good choices. Yes, many people forget that avocado is actually a fruit too. But you should be more careful with very sweet grapes or ripe pears. That doesn't mean you can't eat them at all. It just means your portion should be reasonable, because even healthy foods in large amounts can noticeably raise your blood sugar. A perfectly logical question comes up, so what can you actually have? Let's start with the most popular drink in the world, coffee. And this is where a lot of people are surprised, because there are so many myths surrounding it. Some people say that coffee raises blood sugar, while others insist that you shouldn't drink it at all if you have diabetes. In reality, it's much simpler than that. If you drink regular black coffee without sugar, syrups, condensed milk, or sweet cream, then by itself, it has almost no effect on your blood glucose levels. So 1, 2, or even 3 cups throughout the day are perfectly fine for most people. And what about tea? The situation with tea is pretty much the same. Green, black, herbal. Go ahead. If your cup doesn't have sugar, honey, or sweet syrup, then you can safely drink that beverage if you have diabetes. Some people ask, is green tea healthier than black tea? There is a difference, but it's not significant enough to affect your blood sugar levels. So choose the tea you like best. And now we've reached the drink that many people consider too boring. Plain water is probably the most underrated drink for people with diabetes, especially if your blood sugar is already elevated. The thing is, when your glucose level is high, your body starts to lose more fluids. The kidneys try to get rid of the excess sugar, and water leaves the body along with it. That's exactly why you feel so thirsty. Many people try to quench their thirst with juice, compote, or soda, but that just gives the body another dose of carbohydrates. But plain water doesn't contain anything extra, no sugar, no calories. It doesn't cure diabetes or lower blood sugar on its own, but it helps prevent dehydration and supports your body's normal functioning. So if you had to choose one drink that's truly suitable for almost everyone with diabetes, it would be water. And honestly, humanity hasn't come up with anything better yet. But there is one more drink we can't avoid talking about, because it's the one that raises the most questions. Alcohol. Alcohol and diabetes. Why is this a bad combination? If you've been watching my channel for a while, you probably already know how I feel about alcohol. I don't like to scare my patients, but I also can't say that alcohol is safe for people with diabetes. The issue here isn't even about the amount of sugar. The problem is actually much more interesting. Imagine your liver works like a small factory. Every day, it helps maintain a normal blood glucose level. But as soon as alcohol shows up, the whole factory switches to a single task, neutralizing the alcohol as quickly as possible. Because for the body, alcohol is first and foremost a toxin. While the liver is busy with this process, it almost completely stops performing its usual functions. That's exactly why some people develop hypoglycemia after drinking alcohol, especially if they're taking insulin or blood sugar lowering medications. But after a few hours, the liver finishes dealing with the alcohol and starts actively releasing glucose into the blood. Add to that the carbohydrates from the alcohol itself and the snacks, and now your blood sugar shoots up. It turns into a pretty unpleasant situation. First, your blood sugar is too low, then it's too high, and blood vessels really don't like such sharp swings. So if you ask me whether you should drink alcohol if you have diabetes, my answer remains the same. The less alcohol in your life, the better it is for your health. Now let's talk about what is currently being actively recommended on the internet. As soon as you open social media, you immediately see a dozen videos. Drink cinnamon before bed, brew some ginger, add turmeric to your tea, and your blood sugar will become normal. Of course, it sounds nice, but there's just one problem. Our bodies don't work that way. Let's ask ourselves a simple question. What actually lowers blood sugar? There's only one answer: insulin. It's insulin that helps glucose move from the blood into the cells. Neither cinnamon, nor ginger, nor turmeric can do that. If they could, endocrinologists would have been treating diabetes with a packet of spices long ago. But for some reason, they still use insulin and modern blood sugar lowering medications. That doesn't mean cinnamon or ginger are harmful. Not at all. If you like their taste, by all means, add them to your tea or use them in cooking. But don't expect them to do something they're simply not capable of. And here comes a perfectly reasonable question. Then why are so many people convinced that after drinking ginger tea or using cinnamon, their blood sugar really did go down? Actually, the explanation is very simple. Just imagine, before this, the person drank sweet juice or tea with sugar and then decided to switch to tea with cinnamon. What changed? Did cinnamon start curing diabetes? No, it's just that the person stopped drinking a beverage with carbohydrates. While they were drinking plain water or unsweetened tea, their muscles kept using up glucose, and their kidneys continued to remove the excess. The blood sugar gradually decreased naturally, and the credit here doesn't go to the cinnamon at all. In the same way, you could throw a slice of lemon, a mint leaf, or a vanilla stick into your cup. If the drink doesn't contain carbohydrates, it won't raise your blood sugar, but it also won't treat diabetes. And now we can answer the main question of this video: which drink is actually the healthiest for people with diabetes? The answer might seem too simple. Plain water. It helps maintain a normal fluid balance, especially if your blood sugar is high and your body's losing a lot of fluids. So if I have to choose between sweet juice, soda, another trendy drink, or plain water, I always choose water. What should you do if your blood sugar is still high? It's important to understand one thing. No drink by itself can solve the problem of diabetes. There is no such tea, coffee, spice, or juice that can replace treatment. So if your blood sugar remains high, you need to look for a solution not in a cup, but in your lifestyle. Take a look at your diet. Are you moving enough? Are you gradually losing weight? Are you taking your prescribed medications regularly? Are you monitoring your blood sugar levels? These are the things that really work. They are what help reduce the risk of complications and help you feel better. Yes, it takes time. Yes, sometimes you have to change your habits, but so far, there is no other way that truly works. So don't waste your energy searching for magic drinks. It's better to focus your efforts where the results really depend on your actions. If you found this video helpful, be sure to like it and subscribe to the channel. Here, we regularly debunk the most common myths about diabetes and talk only about what is truly supported by modern medicine. Thank you for watching until the end. Take care of yourself, look after your health, and see you in the next videos.